Understanding and Recognizing Self-Harm in Teenagers, a guide for parents and adults. Welcome to our program, where we'll dive into an important but often overlooked topic: self-harm in teenagers. Self-harm is when young people intentionally injure themselves as a way to cope with emotional pain or intense feelings. It's often a sign of deep inner distress. Teenagers may harm themselves in many different ways, and sometimes, parents or adults might not notice the signs. Today, we'll explore the types of self-harm, the warning signs to look for, the serious consequences it can have, and, most importantly, how to respond in an emergency. Before we dive into the details, let's go over the main points we'll cover. The different ways teenagers may harm themselves. The warning signs that parents and adults should watch for to recognize self-harm. The serious health and psychological consequences self-harm can cause. Specific steps to take in an emergency when you discover a teenager is self-harming. Now, let's begin with the first section. Types of self-harm in teenagers. Did you know that self-harm isn't just about cutting the skin? In reality, teenagers may harm themselves in many different ways, and each person's behavior can be unique. One of the most common forms is using a knife or sharp object to cut or stab their body, leaving marks on their skin. But that's just a small part of the picture. Let's take a closer look at other ways teenagers may harm themselves. Scratching, biting, or burning their skin, hitting, punching, or banging their head or body against walls or hard objects, piercing their skin with sharp objects, pulling out their hair forcefully, picking at scabs or reopening healing wounds, taking too many pills or drinking excessive amounts of alcohol, putting their health at risk, exercising to the point of exhaustion or injury, getting into fights where they know they might get hurt, engaging in unsafe sexual behavior, putting themselves at risk of disease or harm. As you can see, self-harm isn't just about visible physical injuries. Sometimes, it can involve dangerous behaviors that might seem careless or impulsive at first glance. Recognizing these patterns is critical so we can step in and help in time. Signs of self-harm. Next, let's move on to a key topic: how to tell if a teenager might be harming themselves. Parents and adults are often the ones closest to young people, but the signs of self-harm can be subtle and easy to miss. Let's explore the warning signs you should pay attention to. If you notice any of the following in a teenager, it could be a sign of self-harm: unexplained cuts, scratches, bruises, or other injuries on their body, especially in areas they could reach themselves, like their wrists, thighs, or stomach. Frequently carrying or keeping sharp objects, like safety pins, razors, or pieces of glass, without a clear reason. Wearing long clothing that covers their body, even in hot weather, and avoiding situations where they'd need to show skin, like swimming or changing in front of others. Impulsive or unstable behavior, such as sudden mood swings or overreactions. Expressing feelings of hopelessness, worthlessness, or talking about feeling like they don't matter. Struggling with relationships, like frequent arguments with friends or family. Finding bloodstains on their bedding, clothes, towels, or tissues without an obvious cause. Spending long periods alone, especially in private places like the bathroom or bedroom, where they could harm themselves unnoticed. Becoming more isolated and withdrawing from social activities. Pulling away from friends and family. If you spot any of these signs, it's important not to ignore them. Instead, approach the teenager with care and seek ways to support them. Serious consequences of self-harm. Now, let's talk about the consequences self-harm can have. Self-harm isn't just a passing behavior. It can lead to serious health problems and have a lasting impact on a teenager's mental well-being. Here are some of the consequences that can result: increased feelings of shame, guilt, and low self-esteem. which can make teenagers feel even worse about themselves after harming. Infections from wounds, especially if they use unclean objects to injure themselves. Permanent scars or disfigurement, which can affect their appearance and mental health in the long term. Broken bones or other serious injuries from hitting or banging their body against hard surfaces. Losing relationships and becoming isolated, as they may feel ashamed or fear judgment. A higher risk of developing severe depression, substance abuse, and, in some cases, even attempting suicide. It's crucial to understand that self-harm isn't just a short-term issue. It can signal deeper mental health struggles that need to be addressed promptly to prevent serious outcomes. How to respond in an emergency. Finally, we'll cover what to do if you discover a teenager is harming themselves. While self-harm isn't always a sign of suicidal intent, it can still be life-threatening. Knowing how to act in an emergency is vital. If you see or suspect a teenager is actively harming themselves, follow these steps. Do not leave them alone. Stay with them to keep them safe. Prevent access to objects that could cause harm. Gently remove any sharp or dangerous items they might be using. Call the National Child Protection Hotline. This hotline can provide immediate support and guidance. Take them to the emergency room if their injuries are severe or you're concerned for their safety. Get them to a hospital right away. Seek help from a medical professional or mental health expert after addressing the immediate crisis. Make sure the teenager gets the mental health care they need to work through the root causes of their self-harm. Acting quickly can make all the difference and help set them on a path to recovery. Conclusion. Today, we've explored self-harm in teenagers, covering the types of self-harm, the signs to watch for, the serious consequences, and how to respond in an emergency. We hope this program has given you valuable insights and tools to recognize and support young people who may be struggling. If you have questions or need more information, don't hesitate to reach out to professionals or support organizations. Thank you for listening, and we'll see you in our next program.